everyone, welcome back to my channel. Thanks for tuning in. If you are new here, please consider subscribing. If you are a returning subscriber, thank you so much and I really appreciate. Please put on your notification bells so that anytime I upload a new video, you'll be first to be notified. So today, as usual, I'm always excited. Yes, and I'm more excited because I'm not alone. Today again, I'm with a familiar face you've seen on my channel before. Yes, a friend who is a clinical health psychologist, and I'll let her introduce herself to you and you will know why we are here. So madam, you are welcome once again to the Red Flip.
Thank you.
Please introduce yourself to my audience.
So I'm Gifty Amenya, a clinical health psychologist with Ohad Wellness Center.
Okay, thank you very much. So today we want to discuss about sexual dysfunctioning or sexual dysfunctions. Okay, so basically when we say sexual dysfunction, what do we mean? Maybe just in a layman's way of understanding, what do we mean by sexual dysfunction?
So sexual dysfunctions are problems that prevent a person or a couple from experiencing excitement or satisfaction in their sexual activity or in a sexual activity. Or in other words, we could also define, or we could also say that there are problems that are experienced in a particular sexual response cycle.
Okay, in a particular sexual response cycle. So what are sexual response cycles?
Okay, so sexual response cycle is a 4-phase model. It's a 4-phase model of physical and emotional changes that occur during a sexual activity.
Wow. A 4-phase?
It's a 4-phase model of physical and emotional change that occurs during a particular sexual activity or a sexual activity.
Okay. So what are some of the types? The types of sexual dysfunction?
The stages.
Okay.
So we have 4, as I said, it's a 4-phase. So the first stage is the excitement stage.
Okay.
So this is where we see one's arousal in response to a sexual attraction or in response to an attraction towards sex. That is, if a person perceives something or someone that's
sexually attractive to them or appeals to them sexually.
So the response that comes with that,
or the excitement or the edge.
Yes.
Okay. So that's the phase of excitement.
So when a spouse probably sees a naked how do I say it? The nakedness of his or a partner, it could also arouse the person sexually. So what arouses someone may be different.
Okay. So that is the excitement stage or the excitement phase.
Yes, that's the excitement stage. So then the second stage is so the excitement stage comes with some characteristics which I want to mention. So we have something like the increased heartbeat. You could also have respiration during that phase. You could also show you could also have blood pressure. So these are not things that some of the time they're not things that you can see. Yes, I mean, like the blood pressure.
Feeling.
Yes, it's about the feeling.
Okay. And isn't increased blood flow?
Yeah, there's increased blood flow, and this leads to the erection we see in men.
Okay. So it's the increase in blood flow that brings about erection in men.
Yes.
Okay, that's fine. So after the excitement phase, what other phase?
So the second phase is the plateau phase. So this is where the excitement increases. So intensification of the excitement phase. So when the excitement phase intensifies, then we would refer to it as the plateau stage or plateau phase. And in this stage, if it is about increased heart rate, then it means that it intensifies. So
if somebody is feeling 2, if we are rating it and let's say it is 10%, the intensification now goes to 30, 40, 50%, depending on how the person is feeling.
Yes. So let me say you just see someone and then you are aroused. That is for the first stage. With the second stage, this excitement increases, and this could be probably when you now meet the person and you are having a physical, how do I say it, a physical interaction with the person, then that is when this intensifies.
Okay.
Now sometimes it could be you are watching a movie and then you see something that attracts you sexually. It's also in this second stage, it now increases because if your mind still feeds on that, what is making you what's making you excited, then it increases. You get it? Yes. Then the third stage is the orgasm stage. So this stage is the highest or the climax, the sexual climax. So this is where we would characterize it by ejaculation in males. And then some females feel, not just males, ejaculation comes with some euphoria. So and then some tension relieving symptoms. So that's for the orgasm stage. And then how you feel, so for females, how you feel or some of the physical responses may be quite different from another person. And not everyone also achieves, not every sexual activity arrives at the orgasm stage or orgasm phase. Then the fourth stage is the resolution or refraction stage. So with this stage, this is where everything returns to normal. So it's the pre-arousal stage.
So that's before the excitement.
Yes. So that is for the resolution or refraction stage.
So do men and women experience the same response cycle?
So male and females experience this sexual response cycle. Just that with male, it differs in male and female with timing, because a male would achieve orgasm earlier than a female, while for a female it will take some time. So a female sees something that is attractive to him or to her sexually, then something comes to mind again and then she goes off. But as a female, you would as a male, for a male, they easily get to this stage faster than a female.
So what's some of the so in this case, if you mentioned that a male could get orgasm faster than a female, so in this case, what are married people supposed to take note of, since this is different? As in, how are you supposed to help to ensure that you are not the only person benefiting, but both partners arrive at that phase? Because you mentioned also that not every sexual activity brings about orgasm. Yes.
So for marriage couples to achieve the same, or to get to achieve orgasm, we should compromise. It's all about compromising. So that if the male partner knows that this is the cycle, if you understand the cycle very well and you understand that females are slow with it compared to males, then you would have to compromise. Try. So if it's about foreplay or foreplay starting the whole cycle, that you would have to make more effort to get the woman to be at the same stage as you are, compared to the woman doing that. For a male, it may be quite easier. That is, if there's no problem, then it will be quite easier to get to these stages.
So back to sexual dysfunctions. What are some of the types of sexual dysfunctions?
So we have the
partner factors. Types of sexual dysfunction.
Types of sexual dysfunction.
Yes, types of sexual dysfunction.
So we have the erectile dysfunction, erectile disorder. So that is the difficulty we have, the difficulties males have in obtaining or maintaining an erection. Or even getting a rigid erection. How do I say it? Yes. So sometimes the inability
to achieve that is a dysfunction. And another one could be
premature ejaculation. So premature ejaculation is when you have a pattern of ejaculation where you we term it as the 1 minute
before
sex. So a particular pattern where you last for
A very short period.
time,
Okay.
approximately 1 minute, or between 1 minute or to just a point where you desire, or you the partner wishes that you could have done more.
Okay.
Yeah.
But who pegged this thing at 1 minute? Because you hear it all over the place. This person is a 1 minute one. This
That's
person is
because
a
of
1
the
minute
duration.
one. No, but who pegged it as 1 minute?
It's because of
Anyway,
the duration.
I think what the dysfunctions you mentioned are peculiar to men. So what about women? What are some of the dysfunctions or sexual dysfunctions of women?
So we have the female orgasmic disorder.
Okay.
So where a female finds it difficult to have or to achieve orgasm.
So that's a problem.
So, and then all these disorders I'm
Okay.
mentioning, it shouldn't be a one-time something. So it should be persistent.
All right.
And it should have occurred for 6 months. Yes, for us to say it's a clinical issue, yes.
Okay. Or cause for attention.
Yes.
Mhm.
But then as we are talking about it, we would find that sometimes it's psychological. So something that happens maybe once a while or something.
So the persistence makes it a dysfunction, but not the point where it happens once or maybe some few instances. Okay.
Because situations can lead to it.
All right. Sometimes stress, issues of life, and okay.
Then we have with the females, we have the genital pelvic pain or pain during sex.
Genital
or
pelvic pain.
Or penetration disorder.
Okay.
So the pain a female will have during penetration.
Okay.
So pelvic pains.
Mhm.
Yeah. So and then it's also another symptom is the fear of having that pain.
Okay.
So
So the
you
person experiences the pain
once, and then
the next time, the fear of having the
it.
pain. So the fear is now a disorder.
so it's not a problem.
Okay.
Because when you start having fears, it affects you psychologically, and that can affect
It can make
the
it
whole-
repeat itself.
yes.
Or okay.
Sure. So fear of having it, and then the pain itself during penetration, then the pelvic pain. Yeah.
I'm learning. Today I've come to school. Anyway, so you mentioned the types. So what are the causes, or let's say the risk factors?
Okay, so
the causes of the dysfunctions.
Okay, so the causes of the dysfunction, we can look at the individual factors.
Okay.
So with the individual factors, we look at the person's stress level.
Mm-hmm.
As an individual, what stresses you can also affect you sexually. It can affect you. So if you are stressed, when you are stressed, it can affect your sexual life.
Okay.
So financial stress, whatever stress you would be going through can affect you sexually.
Okay.
Yes, so it can cause to go through the sexual response cycles completely.
Okay.
Because you probably are not in the mood for it because a lot is going on. Yeah.
But I've also heard that when it comes to males especially, sex could help them relieve some of that stress.
Yes.
So if the stress is now affecting the sex, how does it now help you to even relieve the stress? It means that partners should help each other to reduce whatever is stressing them in their bid to enjoy sex. Okay.
Yes.
I think I'm right.
Yes, you're right. So
Okay.
sometimes the level of stress is different.
Okay.
So sometimes the kind of stress you are going through, see, it's not about sex, but there are certain times that sex would help you relieve those stresses.
Okay.
Yeah. So it depends.
Maybe the tiredness stress.
Yes. That kind of
when you're
stress.
tired,
Fine, but
that's one.
yes.
But not when life is beating you up.
You have some financial issues you have to sort out the next morning.
I know.
So it happens.
Oh, anyway.
Yeah, and then one other factor is the relationship factor.
Okay.
These are also circumstances surrounding your relationship.
Maybe there are problems,
Yes.
persistent
Yes.
problems every
Sure.
now and then,
Yeah.
and the like.
And then poor communication,
Okay.
because it's a relationship. We are partners. So if you don't communicate what you want or what you want to be done for you during
order
sexual
to,
activity,
yes, in order to achieve that the orgasm
Orgasm,
phase.
yes.
Okay, that's cool.
Then your partner doesn't know what you want, and then we are different people. Your partner thinks this is good for you, I'm doing it, and you are not getting it. It could lead to premature ejaculation, a whole lot of this, because you are not, what arouses you is
It's
different from what
Yeah.
your partner is doing. So you communicate it to your partner. This is what I want. Some people have lived to, they've become used to a certain peak that if they don't get so any other relationship, that is their standard for judging a sexual activity.
Okay, maybe based on previous relationships that they've been
through,
they've been in. So sometimes what they are used to in their previous relationship, they bring that as a standard in their marriage or in their current as a marital affair.
Yes.
Okay, so sometimes when it comes to women, most of the times it's I hear people say that women don't communicate more when it comes to these wants, what they want. And sometimes people feel like, hey, what if I say this is what I want? He would say I'm spoiled and all that.
So that's a cultural or religious factors that could also affect or lead to this.
Thinking about what people will say, society will help society will see me, and
so
how my partner
will think that I am spoiled. I've exposed myself so much that so hey, all this while I think this lady is this. Now I'm married to her and I see what she is doing. When you see when you see some of the fantasies your partner has can marvel you.
Yeah, you'll be like, where from this?
Yes. You might not even say it's where from this, but
in your mind.
And your partner would now, sometimes the way you ask, your partner says that now this thing when I do it, it makes, or when I ask him to do this, he thinks that I am a sport. You get it.
Most of the time it's ladies. I think it's ladies who have that problem.
And then some religions or denominations would say that maybe you don't do oral sex, you don't do this type of sex. Maybe this is what your partner is used to. This is what arouses your partner. And then you are here saying religion says this and this. It affects
even at the detriment of your health. Yes, I agree with you, but if your partner wants something that would affect your health, I'm not referring to you mentioning oral sex, because I'm not referring to oral sex. No, far from that. What I'm saying is that there are certain things that you hear them and they are out of this world. Okay, things that could affect the person health-wise. Okay, but that's what your partner wants. So because so your partner wants continuous anal sex and you keep on doing it, and now you are getting weak muscles at your anus, and now and infections and all that. And just because my partner wants it, because I've heard it places, I've read it, I've seen it.
So this brings us back to communication.
Okay.
Yes. So you should be able to communicate with your partner. And some of these fantasies are weird. They are weird, and then some of them are actually psychological problems.
Okay.
Yes. So if you see that these things don't go in line with, or it gives you some medical problems.
Apart from that, sometimes you hear things like someone wants to be tied, or someone would want to, and you be like,
that topic is another one.
And for a different thing. Because I know you hear some of the things, and you be like, where from this one too? Some people want pain to be inflicted on them before they
gain arousal. Yes, this is how the person gains arousal.
So that's not a problem. Okay.
It's a problem.
Okay. So it's a sexual dysfunction.
Yes. It's a problem. I think this part of it should be discussed another time.
On a different day.
Yes.
Okay.
I think we should try and discuss this one. Let's discuss it. Let's find time and discuss it.
Then I'll bring you back here for that.
I'll be back.
Okay. Yes. So please, what about managing? Or are you done with
the factors? So I mentioned the individual factors, the partner factors,
the relationship, and the cultural.
Yes,
the cultural.
Yes.
I think okay.
Factors,
all right. So how do we manage, or how do people manage these dysfunctions? Like, surprisingly, some people don't even know that they are having sexual dysfunction. Some people don't even know. But in the case where you found out that maybe you have premature ejaculation, because
delayed ejaculation.
Okay. Too. Yeah, and yes, premature ejaculation, delayed ejaculation. You mentioned pelvic, is that genital pelvic?
Pelvic.
Hey,
pain,
I'm doing well.
or penetration disorder.
Okay, so genital pelvic pain or penetration disorder.
Disorder.
When you realize you're having some of these disorders, what are some of the ways can you manage this or maybe seek for help?
Okay, so
especially when it's affecting your marriage or it's affecting the sexual life in your marriage.
yes. So with the management, we come back to the causes.
Okay.
Now, if the causes are psychological, then, and you know, I mentioned the relationship factors. If you can, you look at these factors. You try to find out the causes of this.
Okay.
Is it that anytime we are about to have sex, I am already tired, I have a lot on my mind? If you get to know some of these causes, then as an individual, you would try to help yourself.
Okay.
But if it goes beyond that, if you can't help yourself,
Okay.
I would always say seek professional help.
Okay.
So
That's when they come to you.
the psychologist.
That's when you come and spend our money.
It's needed. And you know, people don't really value the work of a psychologist.
Okay,
They
but it's something we need it.
excellence,
Yes, we need it. Sometimes you have to even be talked out of the situation. Sometimes
Exactly.
it's about someone to
Just
talk
need-
to. Yes, and you'll be fine. Yes. I
talk
think-
therapy, talk to someone, talk to a professional. Don't talk
Okay.
to just anyone.
Anyone.
Yes.
Okay.
Talk to a professional about it, seek psychological help.
Okay.
And then we do the psychotherapy. Psycho, yeah. So we do therapy, talk therapy, and then there is sex therapy.
Okay.
Yes. So, and then also, if the problem is not psychological and it's medical, we refer.
Okay.
We wouldn't do what a doctor would do.
Okay.
We have what we are supposed to do, and then we will take you through some form of assessment before. We will not just get up and say you have this.
Okay.
Now, if you talk to a psychologist and then the problem is just about it's just situational, we'll know how to help you with it. Always talk to a professional.
All right. Thank you very much. I think I've really enjoyed this a lot. Thank you. So basically, couples or people who are facing sexual dysfunction should look us, right? They should look at what is causing the problem. And the root cause would help you to know that it's not about you having premature ejaculation, but it's about maybe the previous premature had, which has given you a fear that you would get it again. Sometimes that could be the problem. Yeah, so, and etc. So whatever the problem is, sometimes it's the mind. So you have to deal with your mind. Sometimes about stress, you have to get some rest. Sometimes about life's issues beating you up. You know what? Let's give it to God. You'll be fine.
Now, when you talk to a therapist, the therapist will help you.
Help? Okay.
Yes.
Okay.
So we don't just it's not just about solving that sexual problem, but we help you go through life so that in subsequent
when you
life
face similar issues, you know how to
deal with it.
Wow, thank you. Your last words to couples facing sexual dysfunctions, and even those who don't even know they're facing. I think you can tell us about some of the ways we could assess ourselves to know if we are having some sexual dysfunctions.
So when we use the sexual response cycle, I think that alone should guide us to be able to know if we have a problem along the line with it. So somebody will say, I've never experienced orgasm before. That is also one. So you should find, looking at the cycle, you should know. And also my last words. So partners should be supportive. When you get to know that your partner is not able to achieve particular response cycle or a particular phase, you just have to be patient with your partner, because when you give your partner pressure, it worsens it. So just be patient and supportive, and also always seek professional help.
Thank you so much. So I believe we've all learned something. Personally, today I came to school. I've really learned a lot, and I hope you have too. Please don't leave this video without tapping on the like button, tapping on the subscribe button, tapping on the notification bell. And until the next video, bye.